Hello there again. Now today, Ian and I are going to be sorting out how he might use what I am calling full role. Yesterday in our tutorial we were dealing with how you yourself might become Mr. Evans.
Yes.
But now we're discussing how you as teacher might use another person. Now you see, these are the matters we have to be concerned with today. That you bring in a person who will demonstrate a lifestyle. And they'll demonstrate it by all the signs you build around them, rather like you did with Mr. Evans.
Yes.
But there you could come out of role.
Yes.
Because you could put everything down.
Yes, right.
So they are locked in their own time, the time they dwell. Not dwelt, because when they are active they are dwelling in their time.
Right.
So obviously you can't allow children to mob them because they are totally unprotected. So it's your job now to become a teacher facilitator. You are in charge of the circumstance. You and the role need to decide always when you are leaving it to the role to carry things while you still go on protecting, or when you are not leaving the role to do anything but pay attention to what you're asking of the role. Now this sounds as if you're saying, well, the children haven't got any part in this at all. Well, this is not true. You are going to let the children get as much power as they can. Just the same.
Right.
But the children must be protected from the role, and the role must be protected from the children in terms of the social behaviour. You see, I was working with a role the other day from another culture where it emerged that the roles culture in dealing with real children was you have to say please every time you speak to grown-ups. This made it extremely difficult for the modern children who were moving back in time to an 18th century circumstance, but what was intruding was the genuine culture of the role person, and the power of the children was dissipated instantly. If we have to say please every time, how can we be grown-up people consulting you about your life? And so that kind of thing, it has to be facilitated by you. Now, the role can appear to be a bit of an act and a bit of a game, and it just amuses and beguiles the class. It passes a nice hour. But I would suggest to you, if you're doing that, get out of the lot and forget these tutorials. You know, say you never met me. They are not like that at all. They are devised to service the relevant learning areas. And if I walk into your classroom and say, why is the role there, you should be able to instantly tell me the interior of that lesson. Straight off, because if you can't do it, you can't devise the role. And so you are defining, because you've seen this is a need of the work now, like Mr. Evans was needed now, because the children needed to have somebody to look at their work. And then you see the role may hold only the power that the framework of the encounter endows them with. The role is not the most important person in this room. The role is an object to create energy in other people, but is personalised, of course. Now, I don't know if there's anything there. I've not explained very well.
I think in earlier tutorials I've come to an understanding about the notion of demonstrating a lifestyle and being in now time, and to some extent that notion of protection, and I understand around that. I'm less sure about these other areas, particularly, you know, the risk that you run in terms of being clear about when the role is needed and what it's there for. Right. I feel more uncertain in that.
Yes, I can understand that. We'll try and answer some of that as we go on through the tutorial then. Now, this framework of the encounter will begin to be very, very important. You see, when you introduced your Mr. Evans, The framework of the encounter then was the people in Airsole were ready now to explain their proposals to you. That is their frame of reference.
Yes.
We need Mr. Evans now because we're ready to explain to him. So whenever you use a role, the frame of reference that the children are in is the important factor. It's not, oh, look at that. It's, now we know why we need that. So their frame of reference, you see. For example, if we dress Derek as a ghost, you know, which is, I've just dreamed that one up, but there might be a time when the ghost of Hamlet's father might be required for interview in order to get to why the play was in the form it took later in the text. We don't have to dress him in too elaborate trappings, but he's locked, he's already dead, he's a ghost. Now, we're not going to meet a ghost. Who are we that need to meet the ghost of Hamlet's father is the framework of the encounter. We may be modern scholars who are trying to see why ghosts are so interesting in plays of this kind. There are all sorts of kinds of attitudes we may have. We may be a group of theatre designers doing an A-level course who are examining how many ways there are to design ghost appearances. That is our frame of reference, you see. So we are only having the ghost of Hamlet's father in order for us to have a point of discussion.
Right, about that frame.
Yes. Now I'd like to make that very clear at the beginning of this, Ian, because that is the bit that stops this being beguiling.
Yes. Yeah, that's what's worrying, isn't it?
Yes, that's right. Now here are the rules then. We prepare the role so that it's focused to the learning domains we want. And the role knows the specific experience it's been designed to serve, and there are no gimmicks. Any elaboration by the role into, you know, loving his play is not on. And as a teacher facilitator, you can nip it smart in the bud. Because the role is letting you run the show. You may occasionally let the kids run the show.
Yes.
But there's nobody in this room except you that carries the total can. There are certain conventions you can use. If we build Derek into a role and I want him to realise you're on your own, I'm trusting you exactly, you can do exactly what you think is right and I will rescue it, then I'll turn my back and leave him to it. I might just walk away. And that convention tells him I'm trusting him and he can trust me. If he gets in a mess, I'll be there right now. Or if he gets the kids in a mess, I'll be there even quicker. Right.
Yeah.
So the second thing is we protect the role person and the class. The third thing is we must frame the encounter so that the children have a point of view when they enter it.
Yeah.
They have a purpose for meeting. It is not you've dreamed up this lovely notion to pass a nice hour.
Right. So, like with Mr. Evans, was
That's
a purpose.
right. Very specific. And tomorrow he'll have a different specification if they need him. He'll never return to the original need. It'll be deeper next time. It may be still to look at their work, but there'll be a lot more challenge in it. And then there has to be this designed, how will we activate the role and put the role to rest when we don't want it? Because there are frequently times when the last thing we need is the role, so it must be laid in some way to stillness, out of centre, off, but not off stage, because it ain't a stage, it's a social event. You see what I mean? Now let's have a look at this last one. Now this role is only dressed as far as the tabletop. If you look underneath, you see his Australian boots, desert boots as well. But above the table, he is Dr. Lister. And in front of him, because we need all his instruments, he has to be a portrait. Because I cannot allow those children to handle those very contaminated surgical sharp, terrifying instruments. So I am forced to make Dr. Lister a portrait. You can't walk in and pick up that. I made a promise that nobody would touch those jars of dried blood. But by looking at the portrait, you see, what you give children is permission to stare. But you protect them always from feeling stared at, because they have not given any permission to stare in the beginning. When you are in role, you've given them permission to stare. When Mr. Evans talks about their work, he stares at their work.
Yes.
You see
Yes.
what I mean? So here we have Dr. Lister. Now you see, he exists because these children, in their final term of junior school, are being offered the opportunity to think like people who do scientific experiments. So Dr. Lister has been selected to serve that purpose, that he has to do microbiology. He won't be calling it that in his time, but they are looking at how does a person make and test experiments, because when they go up to the senior school, they'll need a vocabulary. They'll need the ability to take notes, to observe. This is why it's in their last term. Later, next week, they will work with Louis Pasteur, because Louis Pasteur can do things with Petra dishes and so on. And so is deliberately designed for a future job when they do science in the high school. One would say it's a bit late. You know, top juniors is a bit late. But at least this head teacher coming into that school knew it hadn't been done and decided to try and do something about it. So there was a read where you'd have to have a full role for that. You can't pretend you're Lister. A person can demonstrate to people who are going to be doctors how it is when you are a doctor and help you to try to think like a doctor at this point. I think so. We're ready then. From now on I shall treat you as doctors, as if you've done a medical training and you're passing the first of the important examinations that will allow you to become doctors in the National Health Service of this country. All right? Ladies and gentlemen, I must point out to you that in the Royal Armstrong Medical College there are certain rules for your examination. You will be examined in the groups you have been placed by numbers. You may not, but there is no cheating or changing anything. I'm going to place upon each of your tables a set of the rules for the examination in the history of medicine. You will kindly read these rules as a... I'm very pleased to see that you came in without any bags or coats, because certainly we should have had to take them away from you.
The evidence should consist of practical and written things. All historical exhibits remain the property of the College of Surgeons. The result of
Rule 1. Are you quite certain of what that means? Doctors shall be examined in groups. And as you know, the groups are the groups you are currently in. What about the second rule? quite clear? And the third rule, certificates will be presented on the final day of the current examination. No problems? All questions must be considered. No problems? The examination shall consist of practical and written parts. Quite clear? It means you will be expected to use the practice of being a doctor as part of your examination, as well as having to write examination papers. But generally speaking, when I am here, the practical part of the examination will take place. But when I am not here, you will do the written part after you have had your lunch. Rule 6. All historical exhibits remain the property of the College of Surgeons. Understood? The results of the examination are final, and no post or second examination will be considered. Any questions? I fear, ladies and gentlemen, it means that if you fail this examination, you will not be able to re-sit it. But I'm quite sure that the training you've had will have thoroughly equipped you for any of the problems that you will face this week. Are you feeling nervous? Is anyone feeling nervous? Good. Very well. The examination will commence. The first thing you have to do is do what all doctors have to be good at doing. You have to be a man's work. The name of the man is Sir Joseph Lister, a doctor who took his examinations many years ago. We should like you, first of all, in your groups, to carefully study this room that we have placed at your disposal. Sir Joseph today will answer no questions. There are 3 questions you have to find the answers to and write down what you think. You do not have to wait to write what you know, only what you think is the truth, which of course. You are to think about what this man is most concerned with when he's working. You know already he is a doctor. But what kind of a doctor? And what kinds of things would you expect to find him doing? What would his working conditions be like? We have not given you his working conditions. We've given you the things that he used in his work. How the room would look. Who else would be there? The kinds of things that would be happening. And what the things would be like in the room. Apart from these. From the picture. Every time you have decided anything, write it down. I shall write the 3 questions on the board when I have transferred these cards to there. Let the examination begin now. Remember that all doctors must have access to the museum. You will only need to make one report when you finally do it. Take notes of anything you consider so that nothing is forgotten, ladies and gentlemen. You only need do one report. You simply discuss and one of you does the writing for the others. This is... It would be helpful if you placed day one at the top of your notes. This is the first of the things you are to think about. There you are, ladies and gentlemen. Anyone wishing to discuss it with me, simply come and I will help. Sorry, I thought you were asking me. The surgery side. Scientist of medicine. Put in as much detail as you can, ladies and gentlemen, to help the examiners thoroughly understand what you know. You believe him to be a scientist, do you? Yes. There may well be rats. I'm not sure until I look into the whole matter. But I suppose rats do find their ways around. Do not be afraid afraid, as I know some children are, but of course you're way past this, but do not be afraid to put what you think. There are so many fearful people in the world who only write what they know is absolutely true. In doctoring, the eyes often can tell you things to think about. So don't be afraid. You will not be examined as to whether you are right or wrong. You'll be examined as to how much thinking you've done. Isn't it, that one? Oh, looks like you've got the bloodstream and the, mostly the breathing apparatus, but this suggests the bloodstream as well. Yes, yes, yes. One does wonder what kind of bacteria the man might have been looking into. I can ask the portrait to stand if it helps you get the feeling of him at work, but otherwise he'll stay seated.
Which had already been infected. And we've got the knife. It's 1505, not 1605. What did he discover? The bacteria surgery invented I think he invented it's a possibility. I still let me invent it so I could do the surgery. I get the
I'm going to move the portrait's hands so that you can see the kind of hands he has. Pardon? Oh, does it say 1505? I haven't studied it. May I see? Where does it say 1505? Excuse me, I can't quite see. Oh yes, that would be the date of the seal. Perhaps the college was founded then. Does it suggest that this gentleman was alive in 1505? There may be a date somewhere else. It's rather difficult to tell. Maybe this go into a little more detail on the matter of his working conditions.
It could be chloroform. Could be 1505. Chloroform wasn't invented until it could be bacteria.
Put as much detail in as you can, please, ladies and gentlemen, in the matter of the gentleman's working conditions. After all, medicine is a stand-up affair. We have to do it. And so the more you can show me you understand how people did things, the better it will be for your examination. You have exactly 4 minutes in which to complete this part of the examination. At the bottom of whatever you have written. This is so that no one can add anything once the clock tells us it is time to stop. Please place your signatures, sign your names at the bottom and place them with Norman if you wish. Use the term doctor if you wish to be known as Dr. such and such. I'm quite sure the examiners will understand.
It's the 4th of February. Just put it there.
Sign your usual signature, please.
Signature. Brilliant. Should they actually spell it on the straw? What? No. Hey, you do yours then. Let's do it.
And when all the signatures have been placed upon the examination paper, I should appreciate it if you would just sit there for a moment with the paper safely on the table. Very well, ladies and gentlemen. May I now explain to you the second part of your examination? After you have had your lunch, sometime today, you have to answer a written question. And each one of you must do your own in the best way you can. We realise that this is the history of medicine, and you may not have had too many lectures on it yet, so there may be not a lot you know. This exhibition will be taken away, but you've had a good look at it. In its place, there will be drawings which you can pick up and move about. There will be drawings of the objects that you see upon the table. And this is what you have to do. Take any one illustration of the medical apparatus and explain how you believe it was used. Nobody expects modern doctors to be able to use these things. We just want them to think how they might have been used. No modern doctor will be given these to use. These question papers I shall hand to your teacher, who will conduct the examination this afternoon, and tomorrow morning I shall receive these papers from her. All the questions you have dealt with this morning, please leave on the table, and I will see that they are collected safely. May I thank you for the excellent way in which you have conducted this first part of your medical examinations. Now, take this off. So, the examination for today is over. It was interesting. I thought it looked rather interesting. this one up, look. Can you imagine how it would feel if you were going to use it? Can you? As if it were in your hand. Amazingly light. Just wondering who used it. Right, now when you come back after lunch, there will be drawings on the table, and they remind you of everything, all right? I wish I could come and stay while you do the examination, but I can't, because I'll have to be somewhere else. Then we'll see you tomorrow morning, and tomorrow morning Sir Joseph Lister will be able to speak to you. So you'll be able to find out a lot more. Today you've relied on yourselves. So really, what have we done today off that list? Have you got any facts? Think you've got any facts today? Found out any facts? You do? You've certainly watched someone else, haven't you? What about the thinking? Have you done any thinking? I bet you have, yes. Yeah. Have you done any telling others? When you've been sitting around your table? Have you been telling each other? Right, so you've done quite a few things. The numbers, will you please hand them to me as you leave, so that I have them to hand out to you tomorrow. Don't forget your number. Otherwise, the examination papers will be all muddled up. And of course, will you place your number on the question paper this afternoon? Thank you. Have a good lunch, ladies and gentlemen. Thank you. Please make your number. Sir, have you your number? Are you new, sir? Number 7. Number 7. Did you complete yesterday's assignment and finish the question? May I now then formally receive your examination papers? I need the drawing and the question paper. Thank you. Thank you. Are there any other papers to be handed? Thank you. May I congratulate you on the way you have handed these to me? They are all in the correct order. Did you put the date on and your names? Good. These will now have to be locked up so that only the examiner can see them. I shall place them here in Sir Joseph's study for the moment, who yesterday was the picture of Joseph Lister, today will stand in for the man. And he's done an awful lot of reading about Sir Joseph Lister. So what are you to collect at? Now, I've got a few spares, so we might as well hand them to the table. We'll have more. You've got 5. Can you people manage with one? Now, you don't have to learn this. This is but it doesn't tell us anything about how it was to be him and what he thought about what he did. Other ones? Good. Now, Sir Joseph, these doctors will be coming to talk with you soon, and will you please remember that if they ask you any questions that are written down there, any answers that are in that sheet, please don't take the trouble to answer them.
No,
Will you just remind them that they're on their sheet?
Certainly.
Where it was cut off and when it was cut off. Right. Now let's see what good questions you can discuss amongst yourselves to ask me that tells you a lot more about this, because I have to live with this, you know, I have to live without it and I've got to live with it. I've got to live with having no little finger much, and I've got to live without having half of it. Now, you have a talk at your table and think of a good question that you think will get to know a lot that you'll never write in the books about the facts. And when you think you've got a real good question, ask it after I jammed it in the car door. Yes. Now what we have to say is, was that a kind of, we might have asked this, yes?
Is it like hard to eat and hard to write, or
No.
is it still there?
Sometimes.
Does it ever come in handy?
Yes. But I never wear it. Now, I couldn't say yes or no to that question, could I? Now, you have a quiet talk and say, now, what do we most want to know about that thing? Or about Mrs. Heathcote's feelings? Or about the car? Or where they were going at the time? You see? And think, now what do we want to know about really? Now if we look at this one, she said, did the surgeon take any more off? Now really what she wanted to know about was, did the accident do it all? Some information from me. Right.
What did the surgeons do? Yes, yeah.
What did the surgeons do to my finger? Well, I wasn't actually there. I mean, I was there, but I was asleep. So when I went...
Go to where you can't finger.
Pardon?
Why go to where you can't finger?
It's a nuisance. Have you noticed words with, questions with why in can be answered very short? And words like what, and words like who, and words like when. Shall I write the words down that will make it get a short answer? You see, when did you have it done? 20 years ago. Why don't you wear it? Don't like it. Who were you with? 2 other people. Where were you? In a car. Can you think of any other words like that that we mustn't use to get good answers?
How do you mean by nuisance, you think it was?
Ah, now that's quite a useful one. How? How looks as if I have to talk a lot more. Shall we put how over here? I'm going to put a plus on that and a minus on that, shall we? Try a few how questions about my finger. Have a word about how. See if you can get some information. feel? I see how is one of those words that's about being like something, you know. I was in that state. How did I feel? First of all, I was very surprised, astonished, and then I got a very big pain, and then I felt very sick, and then I sort of started to feel really miserable. Now she got 4 house, didn't she? Any other good questions with Howie?
How did you think I feel after you'd had after it's been bandaged and that?
It felt very tight round very quickly because it's short. It's a very interesting drawing when you draw around your hand. People think that's a very strange creature that's left its mark. It makes people want to know, and there's always something to talk about when I meet strangers. There are all sorts of useful things.
Bandages does it have?
Well, people stare at it sometimes, especially little children who say, hey, she's not got a finger on her left hand. Sometimes it hurts in the very cold weather. And sometimes it feels as if the other part is still there and I forget. And I pick something up with the other bit that isn't there. They say that's true of arms and legs as well. And I drop cups if I try to pick up something and think it's still a whole finger. Because I can remember exactly what it feels like. It's also very stiff. I can never bend it like I can bend this. Right, do you think we've practiced enough on these? Now, of course, I'm very calm and ordinary because we just talk theory so that we know it is a new examination. Now, yesterday we only allowed you to meet the historical instruments. Today you're meeting the historical person. And everything you find out about her, are you? Yes. May I introduce you to these doctors? They've taken the trouble to travel to meet you and to hear about your work. They realise that you haven't time for a big lecture, and so they have certain questions they'd like to put to you. Will you mind if they have a little discussion first?
Oh, not at all, I understand.
Really? You'll wait here till you find out what you want to know, and then it's up to you. No, just go and ask him. I'll go over and ask him. Ask him loud enough so that he can hear well, you know, because...
Yes, a good question for young doctors. I might just speak so everyone can hear. Someone's just asked me what my feelings were like when I was doing operations. Well, one of my feelings was that I had to be very quick. Speed. I was always conscious of how much time I was taking.
Excuse me, Sir Joseph, may I just have a word?
Yes, yes.
I don't understand that. Why so fast? The patients might die fast. Oh, it's to do with losing blood. I don't know. I'd like to know more about that. I have to think of a question about that.
How did you feel when you discovered unaccepted?
That's a good question. Someone's asked me how I felt when I discovered antiseptic. Well, it's hard to say because it was such a long process. I felt surprised at first. I was amazed by the things I'd read in books that helped me discover it. How else did I feel? I felt that I'd have to change my whole way of working, my whole way of surgery. That's something I felt. Very interesting to know. Has anyone got a reason they can tell me why they chosen this profession? And I'll tell you whether it's close to mine, the sort of reasons I had. What is it, I wonder, that drives people to become doctors?
To save people from dying?
Yes, well, that was very similar to the sorts of thoughts I had. To save people. Anything else?
It's a good experience.
It certainly is. It's a wonderful experience.
It must be nice when you just save somebody's life, and they're all very thankful to you.
Well, they are very thankful. I remember when I worked on a boy called James, what's his name? It was a long time ago now. James Greenlees. He was only 11. And a cart ran over his knee, just here. And he'd broken his knee. And it had broken it. It was a compound fracture. You know what that is? You haven't come to that yet?
We haven't done modern medicine.
Oh,
yet.
I see.
Some of them may have a good idea of it.
And the skin was broken. And of course they thought he was going to die. About every second one did. But he recovered. Every time we open up the body, we have to be very careful.
If you feel that you ought to take a few notes now, to be sure you don't forget anything, you know. I'm not pushing you, but if you feel, just come over when you have something to ask and take your notes and keep coming backwards and forwards. And then that way you don't have to wait for each other all the time, you see.
What are the
rooms? Well, in Edinburgh we have very good rooms now. We have lots of light and the air. We make sure the air is very clean. Most important. Clean air.
What about precautions taken?
Sorry?
What about precautions taken?
Well, it's interesting. Precautions. Well, of course, the most important precaution we do take is to put all of our instruments in a carbolic acid solution to keep them clean.
How long does it take to do an operation?
Well, we certainly take more time now. We don't have to rush as much as we did. So it takes a lot longer than it used to. Well, I felt very, very grateful that I'd been lucky enough to come upon this new technique. And I was very happy to see someone was saved.
Did any of your patients die?
Oh, yes.
Did you like it?
Well, I felt very, very sad because I felt that I could, if only I could have perfected my method, and if only those others had listened to me, I could have saved them. I felt that people died if they shouldn't have died. Well, it depended on the disease. Some diseases we could cut the diseased parts of the body away. But there are others that I'm afraid I couldn't do much for. We tried to make them comfortable, but, well, at least in my wards we tried to make them comfortable. Well, I'm afraid some people weren't so helpful. Well, I think the worst accident I've been... I'm not very happy with, I'm afraid. People are always asking me how many patients I've lost. They should be asking how many I've saved. I think, anyway. Would you like to rephrase that question? Well, now that's a good question. I think I can say that we've almost halved the incidence of loss from major surgical operations. So we've saved half those people who would have died. Well, yes, it was my father. He first bought me a microscope. I was quite a young man, and he encouraged me in scientific experiment when I was very young. He felt, of course, that I shouldn't be a doctor straight away, but he was very, very helpful. Very helpful.
You discovered antiseptic. Was there any other things that you discovered?
Well, I've published many papers, and I'm quite pleased to say that I did some work on catgut that I thought was very useful for surgery. Yes. Oh, sorry.
How long does an operation take?
Well, I'm glad to say that the operations that I perform can take quite a considerable amount of time, up to 20 minutes or half an hour, or even longer, because I've got the time to spend now, of course, unlike in the old days. Have I ever had it? Yes, when I was a young man, just finished university, I was very tired from so much studying, and I got quite weak, and I had to, I didn't have to go into hospital, but the doctors recommended that I go away for a rest. So I went away into Scotland for a holiday, a long holiday, and that fixed me up. But I've never actually been in the hospitals I run myself.
Do you always feel depressed when you try out an experiment?
Now that's a very good question. Yes, I'm afraid I do feel depressed. I often feel depressed, not so much about the experiments, but about the people that are around me. Because some of them really, not so much in of course, Edinburgh, but in Glasgow, I don't know. These people do make me depressed.
What was your longest operation?
Well, of course, operations today do take longer because of chloroform. So we normally go up to half an hour or 3/4. They do feel worried, and some of them, I hate to say, don't even understand what's going on. They're not the only ones. Some doctors don't know either. I've had to send patients away from my hospital. There was one young man, compound fracture of the leg. I put on the zinc covering, carbolic putty and zinc covering over the leg, and you know, he would not stop touching it. He was forever lifting it and looking at secondary infections one after the other. In the end, I discharged him. I mean, I couldn't do anything for the man. I couldn't do a thing for him. He kept lifting up the carbolic putty and the tin sheet, exposing his legs to the air, reinfecting himself. 170 days in hospital, his leg still wasn't healed. I had to discharge him. I tried to explain to him about antisepsis. He wouldn't understand, but he's not the worst. Some of those London doctors. The sort of questions that should be answered with statistics. because these people are forever saying to me, "You haven't saved anybody. They would have got better anyway." You listen to this. Listen to what this man said. Simpson. Mr. Simpson, he says that my work does not help people at all, it's just general cleanliness. He says cold water would be just as good as my work. It's ridiculous. Cold water. He didn't like it. Sorry? Many of them. Do you know that I've had patients come to me and they said, "You're not going to put carbolic acid on my legs because it'll burn." And I said, "It's the only way you're going to survive." Would they listen to me? No. They wouldn't listen. Not only them, of course, it was the doctors in London. They were the worst. Cold water. Yeah.
He's a man that just sort of works down a cold.
Well, you see, it's a problem. I didn't ever amputate unless I knew the person was going to die anyway. So, it was a matter of, did you want to live without a leg, or did you want to die? There was no other way. Because once the gangrene set in, once the wound was starting to rot, there was nothing to be done. There was nothing to be done. Offer had to come, antiseptic, the only way. The only way. But of course there were many who said that I was just a quack. And they said carbolic didn't work. I will admit the spray wasn't. I will admit that the spray was perhaps overdoing it.
Did you know what?
Well, Simpson was the professor. I'll read. Let me see. This is what Simpson actually said. One great and most laudable object which Professor Lister has in view of using carbolic acid as a local dressing for wounds is to close these wounds entirely by first intention without suppuration. And then he goes on and says, these results, that is, fixing the wounds without making them really bad, he said, these results have been obtained in the hospitals of Aberdeen without using my techniques, and of course it's rubbish, as all you doctors well know. Absolute rubbish. I was attacked in the medical papers, in the Lancet, time and time again by ignorant fools, and to think they were Scotsmen.
Sir Joseph, I hope you're not upsetting yourself too much.
No, it's quite all right. I'm afraid I become prone to attacks of depression when these people are mentioned. I'm sorry, it's just the questions bring back in my mind these problems I've had.
Absolutely, yes.
What is the funniest case you've ever had?
Funniest? Well, I'm not a man for humour myself. I don't think you can say that I've had much that's been funny. In fact, the hospitals are very grim places.
Ladies and gentlemen, may I just have a word with you? Excuse us for a moment.
Oh, certainly. I must get on with my reading.
I think there's a very important question coming up, and I feel that we should all be able to pay attention to it. It's being asked by the young doctor here, and it's to do with the kinds of tests that Sir Joseph himself applied in his own career. Now, I feel that one of the things we could do here is, if he explains his kinds of tests, he may want to know the kinds of tests modern doctors apply to check out if their work is suitable. Would you be prepared to risk him asking you that question if we ask him it? To try and answer, would you? You see, I can't say to him, we'll ask you questions and you've no right to ask us questions. It doesn't seem very fair, does it? So it's a matter if he says, well, what kinds of tests do modern doctors use about anything to show that their work, they really are curing people. I don't want you to be too upset by that question. I'm sure we could answer it between us, couldn't we? What do you think? Shall we risk that question? Let's therefore stand and ask it like the students did in the day when Sir Joseph Lister used to have to lecture. Sir Joseph?
Yes, yes.
Would you mind helping us put ourselves in the right places so that when you used to lecture to young medical students, we are standing or sitting like you are used to?
Certainly.
Is that possible?
Oh, certainly, yes.
Did you lecture in your operating theatre?
Oh, yes, we certainly did. We used to have a semicircle of seats around, so I could, so everyone could see. The angle was there, the patient was here, and I used to lecture before I operated, never, of course, while operating.
I see.
Always before.
So we should be in a semicircle, so
Yes.
we could be watching you.
Yes, that's correct.
Well, could we do that? Let's stand in a semicircle. We can't sit, I'm afraid.
No, no.
I'll start it at this end, if you can get the semicircle.
Yes. I think if some of you stand over there.
Yes.
Over close there. A nice semicircle, yes. Another couple over here. Two there. Right. And a couple over there. And the rest of you over here, I think. That's right.
Did we have to do anything, Sir Joseph, before we came into the operating theatre?
Well, of course, I always insisted that people who are my students had to go through a procedure. And part of that procedure was in the operating theatre when I turned on the spray. And also, of course, I liked my students to be clean. Their hands, of course. As long as you all have clean hands, I think that would be enough. Very important. Of course, that did cause trouble among some of the students, but they gradually learned.
You mean they disobeyed you?
Well, sometimes they stayed away altogether. They didn't come. Yes, now, what would you like me to...
Well, one of our younger doctors here has a question to ask you, Sir Joseph.
What kind of tests did you use to find out that the antiseptic was really working?
Well, I'm glad you've asked that because it's one of the really important questions I find. Well, would you like the long answer or a short answer here?
Anything really.
Right. Well, could I have the feeling of the group? What sort of what answer would you like? Would you like the long answer or the short answer here? Well, I hear some people saying long. Is that the feeling, the general feeling of your doctors? Well, I'll start, but I must warn you that when I gave the long answer to a group of doctors, supposed professionals in London, they yawned, some of them grumbled, some of them even said, "What's this got to do with surgery?" Out loud. Very rude, I felt. The long answer. You have to go back to the work of Louis Pasteur. No doubt you've all heard of Pasteur's work. And you have to go...
What did you say?
The great French doctor, Louis Pasteur. You've all heard of Louis Pasteur, right? Well, I see that some of my colleagues have heard it. Don't tell me you haven't heard of Louis Pasteur.
Well, tell us about him then, if you've heard of him. I'm just the registrar around here.
I don't know much about him, but I've heard his name and I've seen his name in some books.
Well, open the body, these dust particles with the germs in them float through the air, and especially the air of cities like Edinburgh and Glasgow, which is and has been particularly foul, they float into the wounds, and this causes all the problems we have with secondary infection. This is what I believe. In my experiments, I've taken flasks like this. Actually, more like this one here. This isn't exactly the sort of flask I did use, but it's similar. I take a flask like this, and I'll fill it with blood, or I'd fill it with a broth, a beef broth, and I'd seal it. I'd boil the broth. I'd put a muslin cloth over the top here, and then I would draw out the glass tube thin on this end, so it was still open, so the air could still get in, but the germs couldn't get in because they couldn't get through the bends in the glass tube. And then I would put that somewhere and leave it for days and days, and what do you think happened to the blood or the beef broth inside the container?
May we have a moment to discuss it?
Certainly, certainly.
So it didn't change of itself, it was all the germs that made it change. What do you think? Sir Joseph?
Yes, yes.
We're ready to tell you what we think.
Very good.
Anybody?
Yes. Yes, what would you say?
I think of the trial. But there wouldn't be any germs in. It's supposed that blood only lasts 3 days before it dries up.
Excellent. We have two answers here, and both are correct.
I believe there's a gentleman over here has opinion to express.
Well,
Does it dry up?
it does dry up, yes. It does. But more importantly than that was your answer. What was that again? Can we hear that?
There's no bacteria or germs in it.
Excellent. There were no bacteria or germs in it, so it didn't become infected. But they wouldn't believe me, of course. They wouldn't believe me. The doctors in London, they didn't want to know about that. I took those flasks around time after time after time. I showed them to the people. I said, look, this flask has had blood in it for 3 years. It's had beef broth in it for 3 years. And it's perfectly clear. And the blood is perfectly good. But they said, oh no. They said, they just wouldn't believe me. They said I was a quack. Spontaneous generation.
I still don't understand how he proved it. I mean, in the National Health, we're always being asked to prove it. Aren't we?
Prove that you need this ointment to do this thing. Prove that this will put the patient to sleep. Prove that you can make a heart beat in another person's body. I mean, we're always being asked to prove it. Sir?
Yes, yes.
There's a gentleman.
Oh, sorry.
Would you like operate on animals first to see if your things work?
Oh yes, I did numerous experiments with animals, especially in association with my work on catgut. Of course, they disapproved. The Queen disapproved. But still, I was determined. I knew I was right.
Did the people die before the operations?
The people died before the operations? Which ones?
The ones that have got diseases.
Oh yes, many people died before we could even get to them. Is that the question you're asking? Maybe I'm not quite hearing you right. Would you like to rephrase the question? You'd like to think about that and give me another rephrase that, perhaps. Proof is what you want, is it? You only have to look at my wards. See the number of major amputations. In Newcastle, there was up to 50% of those people who had major operations died. Major amputations, they died. With my method, it was reduced to 12%. I mean, how can you argue with figures like that?
Thank you very much, Sir.
Well,
for the rest of the examination, I think it's important we now get down as much as we can about what we've been able to learn in this one brief visit with Sir Joseph. Can you do that? You don't have to worry about your writing being specially good to read. Make quite sure you get everything in your mind down onto the paper. Could you do it as quickly as possible? Thank you. 5 minutes. Take it in short notes if it helps you. Anything you're not sure of, hurry on. Ladies and gentlemen, it is time for this part of the examination to stop. However, to write an examination question, each one of you to write the answer to an examination question, and this is the question which I shall leave here, and I hope you will invigilate it afterwards. The question is, and perhaps Sir Joseph will be very interested in this question, what do you feel were the problems that worried Dr. Lister during his lifetime in his work? What do you feel were the problems that worried him? Now, I shall leave this with the invigilator so that you may do the answer before tomorrow's examination. This is part 2 of your History of Medicine examination. Will you please leave your papers, your pencils here in the examination room, and I shall see you tomorrow for the 3rd part of this university programme. Thank you very much, ladies and gentlemen. You may not carry out of the room your numbers. They must be placed here as you do.